sat down at the dinner table, all of a sudden, my grandmother just started feeling unwell. So they ended up rushing her over to one of our local hospitals. They told us she actually had 100% blockage of one of the arteries on the right side of her heart, but they were thankfully able to put in a stent, and 2 days after, she was back home, kind of back to normal. So just seeing how much of an impact that cardiologist made in my life, my grandmother's life, the life of our family, made me really want to pursue a career in cardiology. My name is Dr. Rahul Rege, cardiology fellow at North Shore University Hospital and LIJ Hospital, part of the Northwell system. Working in the cardiac ICU, I really saw the prevalence of cardiovascular disease within the South Asian community. At one point, almost half of the unit was South Asian patients. South Asians do tend to be at much higher risk compared to other populations. Actually, in the new AHA/ACC lipid guidelines, being South Asian in itself is actually a risk factor. Just looking at the way South Asian populations tend to store a lot of fat, South Asians tend to develop a lot of fat around their organs. South Asian diet, usually you think of vegetarian or minimal meat in their diet, but a lot of people tend to use ghee or butter. There's a lot of coconut oil as well, and heavy whipping cream doesn't tend to do well with your cholesterol levels. The Long Island South Asian Project, created by Dr. Rajiv Jauhar, Preet Mayal, and also Sunny Singh. They ended up creating the organization more so to help educate the community. They also noted that there was a lack of resources in some of the South Asian community, houses of worship, different churches. You tend to notice that there are AEDs already in place. We noticed when we went to South Asian houses of worship, there are really no AEDs in place there. As part of the Long Island South Asian Project, we've been raising funds. We have already set up a few AEDs, and we're currently in the process of working with 3 or 4 other temples, churches to get AEDs in place right now. We've also developed emergency response protocols. Once they have an AED in store, they know where the AED is, who to call, how to best approach a situation that we hope no one ever gets in. There's a festival on Long Island. We host a booth there. The goal is to talk about South Asian cardiovascular risk factors. We do blood pressure checks, a lot of education activities, just making sure people are going to their doctors on a regular basis, getting their lipid panels checked, their A1C checked, their thyroid values checked, lipoprotein A, making sure they check that. We've held a few different events, the Long Island South Asian Heart Disease Symposium. We invited a lot of South Asian physicians, but then also members of the community itself, and we focused on cardiovascular risk factors, hoping to have an event where we also are able to do lipid testing actually at the event, and also checking lipoprotein A levels. I'd like to thank the American Heart Association for all the support and resources that they've provided us. Using all of that and focusing it on the South Asian community is kind of my goal, and I really take lead from the American Heart Association.